Hi everyone, I'm Dr. Alex Casey with Birmingham Health, and today we're going to talk about spinal injuries, most related to the disc, as well as one of the most effective treatments out there for disc injuries called spinal decompression. And some of the three most related type of disc injuries you may be familiar with or heard of is a disc bulge or a disc protrusion, where it can be, again, moving back into the spinal cord or the spinal nerves. You may have fluid leak out of the disc, and that's what we're going to call herniation. Sometimes the disc can just be thinning out, and that's what we call degenerative disc disease. Those most common areas that happens to is going to be in the neck, which is the cervical region, and those wires can go all the way down to the fingertips, just like this light can be traced back to the breaker box. And so we can trace the symptoms of the nerve from the hand all the way back up into certain areas of the neck. And some of the symptoms that you may feel might be some degree of constant pressure, could be some type of numbness and tingling, or sharp shooting pain, or some people even have burning pain. The other most commonly area injured, that's going to be down here into the low part of the back, and that's called your lumbar spine. And so the same thing with the neck, these nerves that go down into the hips and legs all the way down to the feet and toes, and we can trace those areas all the way back up to certain levels of the spine. And so some of the things that people commonly do to get relief for this is that maybe they may try to do some home therapy, they may try and go get therapy from other places. They may try and do some over-the-counter meds. They may try some prescription meds. Some people even go down the surgical route, and we'll see that a lot of times that those surgical procedures aren't really taking care of the root cause of the problem. So after one or two procedures, they end up finding their way into our clinic. One of the things that we also see people do for some relief is maybe get an injection. They may get a local injection, like a steroid injection, or they may get an epidural, which goes into the spinal canal, and actually they'll inject medicine into that area and hopefully trying to decrease some of the inflammation and pain that you may be having. Unfortunately, this is not one of the most effective treatments. A lot of times we can, skip over that step and only use that as a last resort when only warranted. And many patients that have gone that route probably went down at first rather than as a last resort. And so what we started doing in our practice is that we started introducing spinal decompression, which is this table here. And once we started introducing it, we started seeing our success rates drastically go up, not only with more immediate relief, but with more sustained relief. And what it's doing is that it is opening up that disc space, and it's allowing this negative pressure to occur inside that disc, rushing blood flow, as well as the nutrients that are needed in there, which was prevented and restricted by when this constant pressure and tension was there. So once we start reconditioning that area and opening it up and allowing everything around the spine and in between the spine to get reconditioned, yes, you are going to see more immediate relief as well as more sustained relief. If you got any questions about how this type of treatment might benefit you, just give us a call at the office. You can reach us at 205-385-9999. Till then, guys, have a great day.